If you have heart disease or multiple risk factors for heart disease, your doctor may prescribe colchicine to help reduce the risk of serious heart and blood vessel problems, such as stroke and heart attack. Colchicine works by decreasing inflammation in the arteries. It is important to note that colchicine is not a pain medication and should not be taken to relieve pain. The usual daily dosage for colchicine 0.5 mg tablet is 1 to 2 tablets once or twice a day. It is best to take colchicine at the same times every day to help you remember. Always follow your doctor's instructions and take it exactly as prescribed. Make sure to consult the patient information leaflet from your pharmacist before starting or refilling your colchicine prescription. Take this medication by mouth once daily, with or without food, as directed by your doctor. If you have the extended-release tablets, swallow them whole and do not crush or chew them, as this can increase the risk of side effects. It's important to use this medication regularly to get the most benefit. Try to take it at the same time each day to help you remember. Do not increase your dose or use it more often or for longer than prescribed, as this will not improve your condition any faster and may increase your risk of side effects. Even at the usual prescribed doses, serious side effects may occur. It's also important to avoid grapefruit or grapefruit juice while using this medication, unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects. Always consult your doctor or pharmacist for more details. Some common side effects of colchicine 0.5 mg tablet include diarrhea, nausea, cramping, abdominal pain, and vomiting. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, you should inform your doctor immediately if you experience any serious side effects such as fast heartbeat, shortness of breath, signs of infection, signs of kidney problems, unusual bleeding or bruising, or unusual weakness or tiredness. Additionally, you should stop taking this medication and seek medical help right away if you experience very serious side effects such as muscle weakness or pain, numbness or tingling in your fingers or toes, or a pale or gray color of the lips, tongue, or palms of your hands. While a very serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. Before taking colchicine, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have bleeding or blood problems, kidney problems, or liver problems. Colchicine may affect how well your body absorbs certain foods and nutrients, such as vitamin B12. It's a good idea to consult your doctor or pharmacist for more details. If you have surgery planned, make sure to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, particularly muscle weakness/pain and numbness/tingling in their fingers or toes. For males, this medication can affect fertility, so it's best to ask your doctor for more details. During pregnancy, colchicine should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. This medication can pass into breast milk. While there have been no reports of harm to nursing infants, it's recommended to consult your doctor before breastfeeding. Your doctor may suggest separating the time you take your medication from breastfeeding. When taking colchicine 0.5 mg tablet, it's important to be aware of potential drug interactions. Some medications can affect how colchicine is removed from your body, which may impact its effectiveness or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's important to be cautious of the potential for serious muscle damage, rhabdomyolysis, that can rarely occur with colchicine. This can release substances that may lead to serious kidney problems. The risk may be increased if other drugs that may also cause rhabdomyolysis are taken along with colchicine. It's also important to note that colchicine may interfere with certain lab tests, leading to false results. Make sure that lab personnel and all your doctors are aware that you are using this drug. As always, do not take this medication with any other product that contains colchicine. Be sure to follow your doctor's instructions and recommendations for the best results. If you or someone you know has taken too much colchicine and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the US, you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea, vomiting, diarrhea, abdominal pain, difficulty breathing, and weakness. It's important to remember not to share this medication with others. Your doctor may also order lab or medical tests, such as a complete blood count or kidney/liver function tests, while you are taking this medication. Be sure to keep all medical and lab appointments. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing colchicine 0.5 mg tablet, it's important to keep it at room temperature and away from light and moisture. Be sure to store it in a place that's not in the bathroom, and always keep medications out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product and it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.